projects that will be in the health sector that will support our push to every citizen to have access to health. In particular, the partnership we have fostered with Global Fund has contributed hugely to our country's tremendous progress in combating three of the most devastating diseases: HIV and AIDS, tuberculosis, and malaria. By investing more than $1.8 billion in the past 2 decades in strengthening of health service delivery, infrastructure, and community systems, the Global Fund has facilitated high-impact strategic health programs in our country. More specifically, there has been a 67% decline in AIDS-related deaths since 2013, 85% success in treatment of TB, and a major drop in national malaria prevalence from 8% in 2015 to 6% in 2020. Currently, the Global Fund grants to Kenya for 2021-2024 amounts to $441 million. That is almost, by all counts, billions of shillings, and is implemented by various partners, including the National Treasury, AMREF Health Africa, Kenya Red Cross, and other agencies. The National Treasury implements its portion through the Ministry of Health, NASCOP, Malaria and TB programs, National Syndemic Disease Control Council, Health Systems Department, county governments, and of course, KEMSA. On its part, AMREF Health Africa implements the grant through 46 community organizations, while the Red Cross does so through 65 also community organizations. While it is undeniable that our partnerships have been remarkably successful, we must look forward towards an uncertain future, recognize and prepare for the challenges that certainly lie ahead. This realization is particularly imperative given our post-pandemic outlook. The devastating COVID-19 pandemic was an immense stress test that posed a serious challenge to our health systems and exposed its vulnerabilities. The Global Fund came to Kenya's aid and supported us in coping with the overwhelming systemic burden of the pandemic with significant financial support. This is appreciated, and let us clap for the Global Fund, my good friends. More significantly, the Global Fund stands with us even now in the pandemic recovery phase as we take robust measures to remedy the systemic weaknesses exposed by the pandemic. A major vulnerability highlighted by the COVID-19 pandemic is the medical oxygen supply chain. Kenya has suboptimal oxygen supply and poor infrastructure, as a result of which it is minimally available in public health facilities. The pandemic drastically intensified demand for oxygen, raising its cost by more than 75%. As a result, suffering Kenyans and their distressed families were driven into unprecedented despair. The Global Fund has been immensely supportive of our efforts to strengthen our national medical oxygen ecosystem, and I appreciate the fund's $41.7 million, about 5 billion Kenya shillings investment through AMREF Medical to support our oxygen supply and comprehensive infrastructure improvements, as was explained by Dr. Gitahi. This covers refill of compressed and cryogenic oxygen, acquisition of tanks and cylinders, installation of high-volume PSA oxygen generation plants, and the piping and installation of manifolds as well as oxygen outlets to health facilities. Today, we are here to witness the crowning moment of a highly successful partnership that has seen us through the hardest of times and strengthened us for the future. as we flag off 20,620 medical oxygen cylinders for delivery to our 47 counties, let us reflect deeply upon, but also appreciate with gratitude and celebrate an exemplary partnership that has remained committed and also transformative. We are highly encouraged by the success of our partnership and further emboldened in our mission to deliver to the Kenyan people a healthcare system worthy of their aspirations and consistent with our ambitions for socio-economic transformation. I assure all our partners, those who are present here and those who are not, of our unwavering commitment and tireless devotion to ensuring that your friendship, goodwill, and support yields much more and brings our people closer to the Kenya of our dreams. I also appreciate every actor and stakeholder that has taken part in the partnership that has implemented our public health agenda, whether they are in government, the private sector, civil society, philanthropy, or the communities involved. The implementing partners of our various interventions, and I want to state that we just concluded a small engagement with our county governments who are a critical component of the delivery of health, because health is a devolved function. And we have agreed that because health is a devolved function, we are going to begin from the bottom. In our universal health coverage plan, the unit that is critical and important is the unit at the bottom of the pyramid under a community health promoter. And we did agree in Naivasha that we are going to jointly identify and support the community health volunteers, community health workers. We have now agreed that they will be called community health promoters. And we are going to co-sponsor these community health promoters. We have agreed with the counties that we need to standardize the remuneration of these community health promoters, and we need also to standardize the kits. Standardize the kits that will be made available for them to use in the service they will be undertaking in every village in the Republic of Kenya. This program, hopefully, we should be able to launch when all is put together. I have committed that the national government is going to provide all the kits for all the 90,000 community health workers. And we are already preparing for the delivery of the kits. We have already agreed with the leaders of the counties here, the county governors, that to remove the constant challenge that we have had around the partnership between the national government, the county government, and our health workers. We are going to now inaugurate the Kenya Health Human Resource Advisory Council that is already provided for in law. And we have asked the county governments to provide the membership of this board so that we can use it to address some of the challenges that we have, whether it is challenges to do with the coordination between the national and county government, whether it's the challenges of personnel, especially personnel issues, teachers, not teachers, but doctors who are going on study leave, how we are going to work with them, how we are going to iron out some of the issues that have been raised by our health workers. And I think we now have a template on how we can resolve these issues in a way that gives everybody a chance around a table. We have also agreed with these good people on the subject of the primary care unit, because that will be the lowest unit that is going to account for the resources. And we have agreed that in every sub-county, we have identified 315 primary care units, and it is framed around every sub-county. We've asked the counties, under the leadership of our governors, to identify additional stakeholders to bolster that team, so that the team that exists at the moment of the sub-county health committees, that we increase it by bringing on board a representative of the health facilities that are run by faith-based institutions, health facilities, another representative of health facilities that are run by the private sector, a third person to represent the community, and the counties will provide a forum where the community can elect a person who is going to be in that committee, and also our development partners, maybe like Global Fund, maybe like AMREF, maybe the others who are players in different counties, that they do also provide a representative in that health committee, so that we can have a committee that can assist us to drive the universal health plan. We have agreed with these good people, the leaders of the counties, that this time round we must get it right. And we cannot afford to have a misstep this time round. There's been 2 previous attempts on universal health coverage. This is the time we must get it right. I also want to appreciate Global Fund for the grants, also deserve very special appreciation. We expect uncompromising accountability, good measure of transparency, and proper utilization of the resources that have been put at our disposal. Finally,